You know that moment, you're at the doctor's office and they say, "I think we need to get a scan of that." It's such a simple phrase, but it can kick off a ton of confusion. All of a sudden, you're hearing a bunch of acronyms, technologies that honestly sound like they're straight out of a sci-fi movie.
So what's the deal? X-ray, CT, MRI, ultrasound? What is the difference? And maybe more importantly, how did doctors figure out which one is the right call for you? Well, that's exactly what we're going to get into. We're going to break down the tools doctors use to see inside us, how they work, the risks, and the thinking that goes into every single one of those decisions.
You know, it's so easy to take for granted that we can just look inside the human body. But not that long ago, the only way to really know what was going on was often exploratory surgery. Modern imaging has totally changed the game. It gives us these incredible, non-invasive windows into our own biology. But here's the thing. With all these super powerful options, there's a core principle that guides every single choice. And it's not about just grabbing the fanciest, most high-tech machine. The goal is always, always to pick the simplest, most straightforward, and least expensive test that's going to get the job done and answer the question.
Okay, so let's dive in. Let's open up the diagnostic imaging toolbox and look at the four main tools inside. Each one has a totally unique way of looking at the body, and as you'll see, each one comes with its own list of pros and cons.
All right, first up, the one we all know, the X-ray. The best way to think of it is as a shadow photograph. A machine sends a beam of X-rays through your body, and a detector on the other side basically catches the shadows. Really dense stuff like your bones blocks a lot of the rays, and that's why they show up bright white on the film.
So why are X-rays still so common? Well, the big advantages are pretty obvious. They are cheap, they're fast, and you can find an X-ray machine pretty much anywhere. But their biggest weakness is that they're not great at telling the difference between different kinds of soft tissue. Your muscles, your organs, your fat, they all kind of look like similar shades of gray, which makes it tough to spot subtle problems in those areas.
Next in the toolbox is ultrasound. And this is basically sonar, but for the human body. Instead of radiation, it uses super high-frequency sound waves. A little wand called a transducer sends out sound pulses that literally bounce off your organs and tissues inside, and the machine instantly translates those echoes into a live video on a screen.
Now, the huge win for ultrasound is that it uses zero ionizing radiation. That's the kind of energy that can potentially damage cells. This makes it incredibly safe, which is why it's the standard for things like monitoring pregnancies. It's fantastic for looking at soft tissues and for guiding procedures in real time. The main downsides? Well, the quality of the image really depends on the skill of the person doing the scan, and the sound waves just can't get through dense bone or big pockets of air.
So, what if you could take the basic idea of an X-ray, but make it 3D? Well, that's pretty much a CT scan. Imagine a powerful X-ray machine that spins all the way around you, taking hundreds of pictures from every possible angle. Then, a powerful computer stitches all of those pictures together to create these incredibly detailed cross-sectional images or slices of your body.
CTs are unbelievably fast and give you these amazing, high-resolution pictures of bone, organs, and blood vessels. This is exactly why they are the go-to tool in the emergency room and for trauma cases. But there is a trade-off, and it's a big one. A CT scan delivers a much higher dose of radiation compared to a single simple X-ray.
And that brings us to the last major tool, the MRI. And this is where the science gets really cool. An MRI uses a massive, powerful magnet and radio waves, no radiation at all. The magnet aligns the tiny protons in the water molecules all throughout your body. Then a radio wave gently knocks them out of alignment. As they snap back into place, they release a tiny signal. The MRI machine is basically a giant antenna that listens for those signals and uses them to build an astonishingly detailed picture.
The incredible strength of an MRI is its unmatched ability to show tiny differences in soft tissues. It's the absolute gold standard for looking at the brain, the spinal cord, and inside joints. Plus, no damaging radiation. But it's not perfect. The scans are very expensive, they can take a really long time, and that powerful magnet means that some people with certain metal implants, like older pacemakers, just can't have one.
So we have these amazing tools that can see inside us in ways we never thought possible. But, and this is really important, they are not without risks, and doctors have to carefully balance those risks against the benefits of getting a clear diagnosis.
Look, we're all exposed to a certain amount of natural background radiation just by living on Earth. But it turns out that medical imaging is a pretty significant chunk of our total exposure. And this is exactly why doctors are so careful to justify every single scan that uses it.
And you can see the difference really clearly right here. The extra lifetime cancer risk from a single chest x-ray is tiny, less than 1 in 20,000. But the dose and the risk jumps up quite a bit when you get to something like a CT scan of your abdomen. Now, 1 in 2,000 risk is still small for sure, but it's a risk that you only want to take when it's absolutely necessary.
To put that dose difference into perspective, check this out. You would need to have about 500 chest x-rays to get the same amount of radiation that you'd get from just one CT scan of your abdomen. That really drives home why a CT is only ordered when the potential benefit of what they might find is really, really high.
And it's not just about radiation. Sometimes, for both CT and MRI scans, doctors use an injectable dye, it's called a contrast agent, to make certain tissues or blood vessels really pop. Now, these are generally very safe, but they do carry small risks. Things like rare allergic reactions, and they can put a strain on the kidneys. That's why your doctor will always ask about your kidney health and any allergies before using one.
Okay, so let's bring this all together. When a doctor has a patient in front of them, how do they actually make the choice? How do they navigate all these different options with their different strengths and risks to pick the perfect tool for the job?
Well, the first thing to understand is that it's not a gut feeling or just about picking the newest, shiniest machine. It's actually a very careful, logical, and systematic process that's designed to get the right answer in the safest and most efficient way possible.
And you can actually think of it like a pilot's checklist. Before ordering any scan, a good clinician is running through these questions in their head. Number 1, has this scan already been done somewhere else? 2, is this test truly needed to help this patient? 3, is it needed right now or can it wait? 4, is this the absolute best test for this specific problem? And 5, have I given the radiologist enough information so they can interpret the results correctly?
So, after all that talk about technology and doctors' decisions, what's the big takeaway for you as a patient? How can this knowledge actually empower you when it comes to your own healthcare?
The most important thing to know is that this is a team effort, and you are a vital part of that team. Giving your doctor a complete medical history is absolutely critical. Letting them know if you've had scans done at another hospital can prevent unnecessary radiation and cost. And just understanding that more advanced doesn't always mean better is huge. But most of all, never, ever be afraid to ask questions about why a particular test is being chosen for you.
Ultimately, it all comes back to this one simple but powerful idea. A scan is only useful if the result, whether it finds something or it finds absolutely nothing, actually helps guide the next step in your care. Every single test should have a clear purpose. This technology is only going to get better. Our windows into our own bodies will become clearer and more detailed than we can even imagine. The real challenge, for both doctors and for us as patients, will be to make sure we always use these incredible tools wisely, ensuring that every picture we take truly helps us to heal.